This is discussion 3.1 for LP3, the discussion on JCAHO and JIC and the healthcare global healthcare market. I think it's important to understand who Joint Commission is as well as the JIC International. Joint Commission is an accreditation of healthcare organizations. It was founded in 1951. They are responsible for certifying and making sure in the United States 21,000 healthcare organizations and programs are meeting stringent standards of to meet their accreditation standards and also the highest level of quality care. It's also an enforcement of healthcare regulations to ensure that these organizations as well as programs are following the highest facilities. Joint Commission International was based in 1994, and it's an extension beyond the United States. This is an international certification that is somewhat similar to the Joint Commission accreditation of healthcare organizations. It's a branch off, and they want to assure the same quality of care is being carried out throughout the world as well, not just in the United States of America. Recognized as the golden standard of approval in the healthcare industry. Some of the benefits to JCI as well as JCAHO is for the patient. It's supplying them with the highest quality of patient care. It's ensuring that the care is delivered with efficiency as well as the highest efficiency and quality. It certifies many different programs throughout the hospital, so it just doesn't do it as an overall standard. It is broken down into departments of cardiovascular, as well as stroke, neurosciences, orthopedics, and everything as well. And for the patients, as I said, it's just the big thing is it really ensures the highest quality of care, making sure that there are minimal errors in regards to their care and how they carry out the treatments, as well as the beyond care plans once upon discharged. The benefits for the facilities is there offers many different accreditation certificates, which helps enable some of the reimbursement that they will receive, as well as the accreditation and recommendation of hospitals. Helps them obtain and look better in regards to their stock rankings as well. The higher the ranking and accreditations, the more likely they are to get loans if needed, and so forth. Reducing variation in clinical practices. It's consistent in its care approach. Routine. Reducing the risk of medical errors and improving safety, patient safety and quality, and many different certifications and specialties, as I said before, and ultimately supplying the highest quality of care for our patients. I believe Joint Commission and JIC are pretty much similar. They want to ensure the highest patient care throughout the world, as well as the individual countries. The biggest thing is internationally based is Joint Commission standards, worldwide quality and inspections, setting the gold standard worldwide for healthcare, as well as the Joint Commission here and emphasizes a lot of patient guidelines, patient practices, helps organizations develop consistent practices, and they are, like I said, based strictly here in the U.S. When we talk about the differences between JCAHO and the JCI, they are mostly international, obviously international differences, but they are very similar in regards to the standards and quality that they're trying to enforce. The biggest difference, obviously, is that in the international realm, they need to come to a consensus among countries as to what that standard is going to be, and they can't establish the consensus on what the standard is going to be, as the Joint Commission can do for the U.S. healthcare place. So U.S. does tend to have higher standards than international. They have the international standards try to mimic or come close to that of the United States in regards to their accreditation or certification process. Overall, the goal is to improve the patient experience or quality of care that they are all receiving, and make sure that patient safety as well as facility safety is met by standards that is implemented not just by the United States, by international governing bodies as well. The world effects of the Joint Commission as well as the International Commission is it raises patient quality wherever they go. It's holding everyone to a higher standard, which is great. Helps everyone be more efficient and more effective in their care as well as their cost effectiveness to give care. Help establish standards in all countries as well as internationally in regards to making sure that we are all doing the best we can to deliver the highest quality of care as well as the most safest patient care as well. Helps, like I said, just reinforces regulation amongst all countries involved, whether you're dealing with JCAHO or the international world. That way there's insurances that the care is safe for the patient, safe for the healthcare workers, safe all around, that's held to a standard that just keeps rising and rising. Like I said, with the increase in standards, we will do better overall with our care and delivery of care. That's the bottom line. This is the end of my discussion for week 3. I hope all is going great. I appreciate everyone's patience and understanding, and have a wonderful week, everyone. Great job. Thanks.